Hi, I'm Jeff Todd, President and CEO at Prevent Blindness. Welcome to the Focus on Eye Health Expert Series. Today, we're going to be talking with Dr. Paul Chan, head of the Department of Ophthalmology and Visual Sciences and the John H. Panton Professor of Ophthalmology at University of Illinois College of Medicine, and director of the Pediatric Retina and Retinopathy of Prematurity Service at the Illinois Eye and Ear at UI Health. Welcome, Dr. Chan.
Thanks, Jeff. Good to be here.
A condition that's unique to babies is ROP, or retinopathy of prematurity. What is that, and how is it detected?
ROP, and again, this is where my passion is. It affects the youngest and lightest babies. All right, so children who are born premature are at risk for this. Generally speaking, when we start screening exams, or who do we screen? That's one of the big questions. There are very set guidelines around this, right? There are very specific rules that we follow all around the world, right? And it's going to be very regional specific. In the US, we screen generally every baby who's less than or equal to 30 weeks of age, and then less than or equal to 1,500 grams. Okay, so these are the children that we screen. And then, of course, any child that the neonatologist feels that we should screen for whatever reason. Maybe they've had a challenging course, or they've had infections, or they've had significant oxygen exposure. These are children that we screen. It's better to be screened than not to be screened. And if you screen a child and there's no significant change, that's good. What you don't want to do is miss an exam, and then all of a sudden there are changes that may require treatment or lead to blindness. Okay, so if your child is born premature, very important to ask these questions about, should my child be screened for this condition, which is retinopathy of prematurity. Now, having said that, once your child is within our service and is getting eye care and screened, generally in the NICU, okay, in the NICU at first is when the first exam is. Every exam determines when the next exam is. So the findings from the initial exam will determine whether or not your child is seen in a week or 2 weeks and so forth. And what do we look for? Okay, so in ROP, what happens, it's like everything else when you're born premature, things are not fully developed, right? So in the eye itself, the retina is not completely developed, and specifically in terms of the retinal vasculature, or the retinal blood vessels, are not fully developed. So, the way I describe it to parents is, if you have a growth of the blood vessels, and these are the blood vessels, and they're growing, and they can just stop. Okay. And when they stop, you can develop this area, which call ischemia. And ischemia is where there's no retinal vasculature, retinal blood vessels. That can stimulate the formation of these growth factors and other things that can then promote the formation of new vessels. Okay, and these new vessels can also develop pulling on the retina and so forth and so on, and you can see changes in the retinal blood vessels that we would call something called plus disease. Okay, so what are the things we look for? We look for zones, we look for stages, and we look for the presence or absence of something called plus disease. The way I describe it to families mostly is, zones is our geography, right? It's how much is the normal blood vessel development. And you can have zone 1, 2, and 3, and the lower the zone, the more severe the disease. And then you can have stage 1, 2, 3, 4, and 5. And 4 and 5 are divided into subcategories. We won't necessarily go into that. But the higher the stage, the more severe the disease. Okay, so generally speaking, mild disease is a higher zone in a lower stage. Okay, but there are certain things that we look for, specific categories of disease that we will either see your child more frequently or may indicate treatment. And generally speaking, we mentioned this thing called plus disease. If you have this plus disease, then your child will need treatment. Okay, so very important, that your child is screened early. Very important that they have these exams. And if you're discharged and you go home, very important that you make the follow-up exams so that the ophthalmologist can provide the care that is needed for your child.
Thank you for that. I know this is really a very alarming and often devastating condition, and which is why there's a lot of research in this area. Can you talk a little bit about some of what's going on the research front as it relates to ROP?
Yeah, so I think over the years, really over the past 20 years, there's been a lot of movement and a lot of advances in the way we treat children. Historically, you go back to the 1980s, when they started looking at whether or not treatment mattered or not. And when you think about people who've been blind from this disease, you think about Stevie Wonder, for example. And that was back in the 1950s and 60s, where they didn't have good treatments for this. Okay. Now we have lasers for treatment, right? We have now injections of medicine for treatment. We've now just had the first FDA approved, at least in the United States, medication in aflibercept or Eylea for this condition if you need treatment. But there are also some other drugs that have been used, specifically bevacizumab or Avastin. So you hear about all these things. So there's a lot of research in terms of therapies. There's a lot of research also in terms of diagnostics, right? And how do we screen better, better protocols? Me specifically, I do work in artificial intelligence and telemedicine with a group with Pete Campbell and some others, and Mike Chang, who developed that group. So there's a lot of people in this space looking at how to make care better for children, but also risk factors and so forth. What's nice now for parents is that if we catch it early, we can save your child's vision. And then as we go forward, what we're potentially trying to do is limit the number of exams that are required for these screenings, and also provide better treatment modalities. So a lot in this space. I think it's an exciting time for all of us, but most importantly, we can prevent children from going blind.
Thanks so much for your time today. Before we sign off here, do you have any other final thoughts you'd like to share on children's vision and eye health?
So Jeff, first off, I want to say thank you to you and Prevent Blindness for having this discussion. I think it's critically important for families to understand the importance of eye health in their children. And very importantly, as we mentioned over and over again in this conversation, better to get checked, better to make sure that things are going well. And if there are any issues, having those issues addressed early. So again, this is a team effort on every level. And I think for the parents, getting your children examined and cared for is the most important thing.
Yeah. Well, thank you so much again. And for anyone looking for more information on children's vision and eye health, please visit the Prevent Blindness website at preventblindness.org or the website at the National Center for Children's Vision and Eye Health, which you can also find on the Prevent Blindness site. Thanks again, Dr. Chan.
Thank you, Jeff.